What's going on, everyone? Welcome back to the channel. My name is Dr. Vincent Esposito, and today we are going to be talking about what can you eat if you're diabetic, if you have insulin resistance, if you're pre-diabetic even, and we're going to go over the basics of what should be eaten and what's probably best for you. But before we get to that, if you haven't already, please subscribe to the channel. We're coming out with videos twice a week on everything: nutrition, health, lifestyle, wellness. So if you're interested in any information like that, subscribe below and hopefully you'll learn something. Now, the first thing I want to talk about before we get into the specific foods is the importance of setting up habits long term. Now, instead of focusing on things that are like quick fixes or 7-day, 14-day, even 21-day challenges, you want to focus on things that are sustainable long term. Well, chances are, if you have insulin resistance, if you're pre-diabetic, if you're diabetic, it did not just develop overnight. This is the amalgamation of things that happen over years on end. So it's important to take a longer view when you're looking to treat the problem overall. So if it didn't come to fruition overnight, it's not going to go away overnight either. And taking a longer term approach from months to years even, and doing small things that are sustainable and building upon them is going to be really key to your success going forward. So a great place to start when you're looking to control diabetes is to add more fiber. More fiber-rich foods are really going to be key. And the reason for this is when you consume fiber, it slows the release of glucose into the bloodstream because it's attached to that insoluble and indigestible fiber. Additionally, eating fiber-rich foods will help with weight loss, will help with preventing cancers like colon cancer, and obviously help reverse diabetes and insulin resistance. And also, because of the fact that you will feel fuller longer, it actually helps control weight and even reduce weight by increasing the amount of fiber you're eating. It also helps with reducing the risk of heart disease, and all of these risk factors actually increase once you enter the pre-diabetic or diabetic stages. Now, in terms of what works best when it comes to controlling diabetes and pre-diabetes, is actually a whole foods based approach based primarily around legumes like chickpeas, lentils, split peas, other forms of beans, as well as high amounts of fruits and vegetables, usually on the end of at least 10 servings a day, and whole grains, while also discouraging and reducing the amount of animal products through meat and dairy. By following those simple guidelines, you will actually reduce the risk and help reverse prediabetes and diabetes, while also improving blood lipid levels, cholesterol levels, and reducing your risk for heart disease, all of which are major killers today here in the States. In fact, following this plant-based approach was put to the test in a study done in Asia, where two groups were given different diets. One was a control group that was calorie counted for and portion controlled, while the plant-based approach was allowed to eat whatever they wanted. And turns out the plant-based people were able to lose even more weight despite being allowed to eat as many calories they wanted. So the goal of this study was to focus on food quality versus food quantity. And turns out quality helps with fat loss even when you're not calorie counting, which is a huge deal going forward, because weight gain is another symptom and precursor to diabetes. So getting weight control under management is really important when it comes to controlling diabetes as well. Even greater is this study found that following the plant-based approach dropped hemoglobin A1C levels the same as any diabetic drug out there on the market, which is really powerful considering you don't get any of the side effects associated with the drug. Now, one of the things that comes up when we talk about a plant-based approach or a plant-based diet in the long sense is that it just gets kind of pushed off to the side with all kinds of other diets. But there's such a mountain of evidence out there that supports whole food plant-based approaches when it comes to preventing and even treating diabetes, when it comes to what to eat and it playing a big role. It's really important that making this transition is feasible, and it's obviously going to take some time, but it doesn't happen without that change in mindset. So making slow changes and incorporating more things in different ways is going to be really key. And I will post my video above on healthy eating hacks to kind of get you started. I think it's a good place to get started there. But what is encouraging, in some countries on the national level are starting to take a chance and really promote this. I know Canada, for instance, is really promoting plant-based approaches while discouraging the use of meat and dairy for treating diabetes and the other complications that come along with it, like heart disease and even certain forms of cancer, which is really, really nice to see. At the end of the day, type 2 diabetes is a diet-caused disease, and the answer to the question is going to be what you're eating. Now, while that might not be the most popular thing here in the States, I am very happy to say that this is slowly changing, and it's going to be a real key to address what you're eating and adopting more of a whole food plant-based approach, because you can prevent and even reverse diabetes by starting sooner than later. So it's really important to get ahead of it as soon as possible and try to get back some of that health you might have lost in the interim time. I do think now that we're in 2020, I hope this decade starts to take some of this scientific literature and it gets immersed into our culture at a more accessible level. So I really hope you found this information helpful today. If you have any questions, comments, and things like that, keep the conversation open in the comments below. I will be happy to get to them as soon as I can. And if you haven't subscribed and you like the video, please subscribe below. Again, coming out with videos twice a week. And I'd be really happy to engage with you and see what's going on. But until then, take care, guys.